uh, continuing from governance, like as part of gaps, in my opinion, like I think people and program management plays a very important role. For example, governance is something like we have people of that kind of a caliber or profile who are typically very senior and very, very busy. They set the directions, provide the decisions on very complex issues, but then there should be someone, a team, which will translate such decisions or directions into more tangible actions. And there has to be some kind of a bi-directional communication that's happening between those governance layer as well as the operational layer. So I feel um, program management without program management, G, A, and S may not be possible. It may just end up with a gas. So, 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 so this is like, of course, like it's not without bias when I'm saying, because we have been working with the countries, and then Ehin has been Ehin has facilitated 7 convergence workshops over 7 years, and one of the main gaps that we have come across is an absence of a program management team. In the sense, like I would say, I'd like to simplify this definition of what is program management. We have added people to make it very clear. It's about the workforce that makes things happen. And then without this, like none of the other things will be possible. And most of, if you look at the ministries of health, I'm sure that over the years, there are multiple digital health projects happening. Like maybe it could be DHIS2, it could be many other digital health interventions that could be taken as a project. That's probably easier to manage if it is one intervention, but then it becomes multiple. And typically, what I would say, multiple projects, which is a program, then it becomes difficult to manage. And then there has to be a team which has the specific skill set and the capacity and the capabilities to manage. That becomes an issue once the number of digital health interventions multiply in a country. So this session, like I would like to keep it very interactive, very simple questions. I would like to involve the ministers of health who are here, because they are actually the senior decision makers in their own ministries, and then they may already have such teams in place to know their experiences and then insights and feedback of what ideal program management team could be. Not only ideal, mostly practical, and what kind of skill sets and capacities and capabilities that need to be there, because this is somewhere, this is something that Ehin has been, we have the mandate to actually deliver in the region. So I would like to keep it that way, simple and interactive. I would like to call upon the Ministry of Health representatives. Probably I will start with Dr. Chansali from the Department of Planning and Cooperation, Ministry of Health, Lao PDR. And Dr. Chansali, do you have a team that is dedicated for digital health agenda in your ministry, or like it may not be even dedicated, but then have a team that has the mandate to work on digital health agenda? Do you have that?
Hello, thank you, Chai, to mention about this program management. This is important. Adding that you have said about this role of the program management is very important. No matter you have very good governance or architecture or standard, if you don't have someone who are day to day working coordination, working with different partner to base on what you have already in strategy, how you can implement, how you can coordinate with other partner or other ministry, is very key thing to moving the strategy implemented. How, but that's why your question about who are will work in this program management unit is very also very important. That I think it should be combined between the who are the government who are knowing the system, and also technical people who are knowing the technical thing, and the day-to-day working. They are not, because you cannot rely on the government because they have many things to do. They have very busy. So you have to have someone full-time staff working on. Currently, we have contractual staff. We contract other people, especially IT people and other people who are experienced in different kind of digital or IT people, many IT people, to work on in one group So probably these groups need to be officially adopt, officially set up by Ministry of Health. Now currently we don't have that. Even we have the people who are working in the department, but they are not officially knowing yet. But probably after the strategy has been approved, so we have officially set up this team to stimulate to day-to-day working on how we can make the strategy implementable. Otherwise, people getting busy and no one continue to work. Thank you.
Thank you, Dr. Chancellor. If I may summarize, like your requirement for a program management team, it need not only be the government, but then it could be anybody else. But as long as they actually comply or they come within a particular TOR in terms of what to deliver, I think that should be okay. But then you agree that there needs to be a program management team dedicated for digital health agenda in the country. Thank you very much. And then if I see another analogy I typically mention in some meetings is this program management team, as I look at it, they are like neurons, right? They need to carry to different layers the messages. And then because sometimes the decisions are complex, not everyone actually understands. Like for example, Dr. Fazila was mentioning about enterprise architecture. Not everyone probably gets a clear idea of what it is. This is one layer that liaises between other layers and makes people understand, probably conduct meetings, like even to conduct meetings of steering committees, take minutes and then circulate it, get the concurrence of people. That itself is a big job. It typically does happen from what I have seen in my own experience. So I would say that they are like neurons as well as the connective tissue between the bones and muscles of governance and operational layers. And the second question is, we have any specific skill set that we see, because this could be country specific in the region. Again, AHIN has been working on developing these capacities and capabilities in the region. It will be good to have your views from different ministries that what kind of requirements in terms of capacities and capabilities that you need, so that we could actually plan it in the strategic plan for the next year and deliver it. So I would like to call upon uh, Malaysian team, because I know that you have been working on, I think, project management and then program management also. So is there any particular skill set that you have been delivering as part of the Ministry of Health training for digital health? And then do you have, again, the same question goes to you, do you have a team that is dedicated to digital health? It could be under different departments because structures could be different in countries. Thank you.
Well, if we want to say regarding the people that in charge of digital health departments, we have the informations management divisions that looks after all the digital health initiative that happens over the ministry. And then across all the ministry, we got a certain program. And then from all the program, they got the champion that take care of the informatics in that program and digital health initiative within the program. If you want to say the champion for the standards and the informatics, that would be the Health Informatics Center. And then if you want to say we look into the research, there will be our NIH Institute, our Digital Health Research Initiative, that will be the champion for Digital Health Initiative. And then when we want to talk about the digital health itself as a whole within the Ministry of Health, perhaps when we come into our digital strategics, that's where we are there together, talk to each other, and coordinate the digital health initiative and the directions across all the program. That's how we do the collaborations.
So you mean that though there are specific units which champion, but then there is a coordination mechanism?
We have like several committee, National Informatic Committee that oversees all the informatic and the digital health initiative within the Ministry of Health. So that's the one governance and the committee that look into all the program and look into the directions of the people within the Ministry of Health itself. Yep.
Yeah, thank you. And do you provide any specific training to this kind of staff, or do you have a need for any specific skill set?
Actually, we are interested into when we're looking about from the way pro the digital competency, digital health competency frameworks. I think we should look into that as some sort of standards, the directions that may be needed for the digital health worker or digital health personnel in the future. Perhaps because like currently, even in us in the health informatics center, when we want somebody to be like the champions or to be the program officer for a certain program or for a certain system, we do send them for the data science courses. We do send them for to take the master in the health informatics or perhaps in any data science courses or data analytic courses. But we are also still wondering what is the specific skill or a set which is needed across the health worker. And then we're also wondering if they are the program officer, if they are the middle manager, or they are like the personas who are the technical officer. What's the difference between the program officer, the middle manager? Is there any requirement that they require different kind of skill, different level of skill? So we are looking forward actually in the web pro standards or the framework. Maybe we can use that framework to become the prerequisites into what kind of the set of skill which is needed for the digital health personnel.
Thank you. Thank you very much. Is there anyone who has or who has already taken the digital health leadership course, like digital health planning national systems? Could you raise your hands? Okay, we could see the guru himself, of course. And another thing that like this keeps coming up, like we do build capacities in the region, but then if there is no mandate in the countries after the capacities are built, and probably they don't stay on, they may have to go where such skills could be practiced. This is another very important aspect of capacity building. Is just not about training, but then how there is a re-entry, and then how they are recognized after that. Will so and so will continue to be in the same designation with the same payroll, and then, or maybe not have any designation to do with digital health? Maybe they may be just called HMIS person or probably statistician. Typically, these are the departments which also deal with digital health from at least the experience that I have seen. But then, does any of the countries here represented here, do you have a department of digital health in your countries? Is there anyone? Health informatics? Thank you. So this re-entry plan or retaining the miss, is there a career path? Like, do you see a future of having a career path for digital health in the ministries? Because many of them still do not have specific roles and responsibilities. Dr. Fazila, do you would like to answer that? You're already gone. Thank you.
Yeah, sorry. Because I'm very passionate about uh, building the generation of digital health. I'm very passionate about people, So actually, I came up with a framework. What are the requirements for digital health? Um, yeah, but it's in a slide, okay. But I have tried advocating. It didn't go anywhere.
You mean the pillars that you used to have at the house?
And so I had what are the skills, what are the different skills. It's like a very simple framework I did, but it didn't take off. I still have that. And but lately we are trying to there is no career pathway in that sense that you are recognized as a digital health specialist, but you can be recognized as a orthopedic surgeon or a hepatobiliary, but there's no digital health. So we are trying to push that in now in Malaysia, to have to recognize these people as subject matter experts and to get some allowance, because the specialists get allowance in their payroll. They get allowance for specialist allowance. So but we have not succeeded yet. And many of there are more and more interest in digital health, not only among doctors but also among nurses, pharmacies. So that is one we are trying to do. And number two is also the masters in health informatics. More and more people are taking that, but retaining them is very difficult. So we did try to put up a paper for retention, but also did not go through. So this is, I hope, as we move forward, when we know digital is so important, not only in health, in every sector, I hope these people are recognized, and we can have a career path for them.
Thank you. Thank you. That reminds me about the health informatics course in Sri Lanka. I'd like to have Dr. Palita sharing the experience from there because I think Sri Lanka has this unique opportunity to have the uh, doctors trained in health informatics. And then I see a very young team in Sri Lanka doing a lot of digital health work. So I think let's know their experience. Dr. Palita, is
Yeah,
it sort of means it's only for the doctors right now?
this health informatics. Now, in Ministry of Health, there are two main categories. One thing is doctors who are following the health informatics. So they have the MSc and MD, that is the specialized in health informatics. Dr. Pramod is actually his senior registrar is going to be a consultant. So likewise, so there's a career pathway for that team, and there's a deployment plan and for the provincial, national, and hospital level. So that is a one layer. So it's I think Professor Wajira, I think he initiated this, and it's a very good thing. But apart from that, one thing is we need a fair amount of card to fill the vacancies. So per year we are getting around 10 MD specialists. So we are predicting around 50 by 2025. Then ICT officers. These are the other categories coming from the with the basic ICT degree. They are also in the Ministry of Health, and they are also valuable in maintaining the networks, hardware components. So especially at different levels, national level, program level, and maybe public health programs and hospital level, and then probably at the regional level also looking after many institutions. So there are different skill sets needed. uh, Again, even with health informatics and other people, we find like cyber security and very specific areas, software engineering, those things. Sometimes health informatics are doing those things, but
Not in
probably
the depth.
not. Yeah, yeah, we need the depth and the breadth in certain areas. So that's the overall.
So can I say that like right now the okay you have this do you have then the digital health roles in the ministry for these people who are getting trained? So
Yes,
you have that.
yes. Right now, the ministry is absorbing them after the foreign training. Their foreign training, they will be a board certified consultants. So they will be deployed. They're already deployed in the ministry now, almost like 12, 15 people. So every year, around 10 people are coming back.
So you have the MSc training in Sri Lanka and then also overseas in the
MSc and MD, that is
MD.
a
Yeah.
PhD,
Yeah.
equivalent to PhD.
Okay.
So MSc, there are about 50 or 6, maybe like 70 people are there with
Wow.
the
That's a good number.
informatics. Yeah.
And do you think that now that digital health blueprint is in the verge of say publication or implementation, do you feel a need for any specific certifications that the team in Sri Lanka needs? Because this is something that might be useful for AHIN to keep it in mind and then plan it.
Yeah, even with the now for the rollout, I think the critical mass is okay now. Basically, now with the coming years, that will be okay. But there are specific knowledge skill sets need to be added to this, even for health informaticians. So actually, we were discussing with this Professor Vajra also. Probably we need to rethink and relook at the existing curricula and
Curriculum,
to
yeah.
add certain components.
Thank you. Thank you. That's very valuable, helpful. Thank you. We would like to have Dr. Yuli from the DOH Philippines.
So, good afternoon, everyone. For the Philippines, we are very fortunate because we've been mentored by two AHIN committee members here, Dr. Alvin Marcelo and Mom Jovi Aragona for our National eHealth Program Management Office. So, what we've noticed for people and program management is that it's the linchpin for making sure that all the governance directions and activities will be executed. So as long as you have a good program management office, you will be assured that all the directions, all the activities will be realized time on target. And for us in the Philippines, we followed strictly the National E-Health Strategy Toolkit, the one shared by Dr. Alvin Marcelo earlier, wherein we have the governance structure on, we have a National E-Health Steering Committee and a National E-Health Technical Working Group and a number of e-health experts group. And for us, we have a National E-Health Program Management Office that is responsive, or that corresponds, wherein one e-health project staff corresponds to one e-health experts group. And little by little, we've made strides because right now, from an ad interim e-health program management office, what we have now is an entire division, an e-health systems division, is an functional unit within our office. And what we also have observed is that for a good program management office to thrive, each of the staff not only needs to be good administratively, but also train on certain technical expertise like on enterprise architecture, uh, program management, project management like the Prince and PMP, and at the same time on data management. And moving forward, we have a pending bill, proposed health measure on e-health system and services act, and hopefully it will be approved in this 19th Congress in the Philippines, so that all the requirements for program management, not only at the national and regional level, but also more importantly at the local level, will be institutionalized. So thank you.
Thank you. Thank you. That was very comprehensive and very helpful. Thank you. I think I'll move to Indonesia now. Call upon Dr. Rudy. Rudy, I know that Indonesia is similar to India, like we follow the federated structure. So how do you think program management team functions or should function in Indonesia?
Thank you, Jay, and ladies and gentlemen. Yeah, right now in Indonesia, we mentioned that we have, Pak Anies mentioned also yesterday, Pak Setiaji mentioned we have a digital transformation office. So with digital transformation office, we have coordinate with the team. I'm from the Ministry of Health. We must coordinate, we must collaboration, but it's need how to make the management of our program. Right now, we in the era of health transition and health transformation. And right now, with the health transformation, we have 6 pillar. And with the 6 pillar, one of the pillar is about digital health transformation. And also, right now, Indonesia has a blueprint for digital health transformation until 2024. And right now we make the program with another pillar. So another pillar of the health transformation is need technology. So we together, we make the program, and also the management of our program is coordinate with the team for the another program and another ministry in our country. Also with the region, with the province, also with the district area, we coordinate with the Ministry of Internal Affairs. So we need enhancement the power of the collaborate in Indonesia. I think that, Jay.
Thank you. Thank you. I think I could see Anis, like Anis, you come from the academic background. So is there any specific skill set or specific functions that you think a program management team from the Ministry of Health Indonesia should have?
For working together many times with training program at the Ministry of Health, and we have also initiated a training program specifically for the staff in the district health offices in 2011, 2012, supported by GIZ and also the Global Fund Health System Strengthening at the time. We learned that the continuity of the training program is important. But also the most important is also career path. We learned that those joining our program mostly from different background, either those with a public health background, a few are also nurses, and other also very few are from the information technology. In the district level, the important challenges are the recruitment of the information technology background in the health organization. Mostly, those, especially for the civil servant, people with IT background are not prioritized in the health sector. Mostly, they are working in the office of informatics. So those who are fortunately recruited at the health sector will be look like isolated. They are very few people working only with a few team, and then working very hard to handle many barriers and challenges on starting to implement digital health in health sector. So you see that this is also the most important challenges, especially for the IT background in the health sector. So what we propose is that it is important for them to prepare on the IT program management rather than directly to support on the IT specific technical aspect, because they could not work when they return home because they are just alone. It is better on how to prepare them to work with many third parties so that they could work together. That's our insight during that time. And secondly, the situation already changed. Right now, many IT staff are available in, especially in the central level, but still in the provincial and also the district level, the issue are not changed very much. So what we propose is that we need to work together with, for example, universities. Currently, our Ministry of Education started to develop internship program for students to work directly at many institutions, and it could also be counted as credit for one semester, not just for internship for only 2 months. It is not enough, but they could work, but as part of internship and supervised by universities, but in a whole semester. So it is also among the idea. But then you see, I think increasing the IT staff in the health sector is also important, but also other aspect in our opinion on how to improve the skills of the staff in the health sectors about the process on procurement and also the management of IT technologies, because I think they are very well known about many medical technologies, how to procure, how to prepare, but for this IT technologies, especially when we are talking about the new coming technologies like cloud, AI, and everything, no standard are available. So they are very, I think, very need about the standard on procurement and also maintenance, and also after that, how to prepare the procurement and also the bidding process. So in spite of the technical aspect on the digital, I think the managing the digital are also important for the health staff. Thank you.
Thank you, Anis. That was very, very, very helpful. I think I'll ask Sami, what's the kind of needs that you have in Maldives? And then do you have any specific or a dedicated team for digital health in the country? And then do you have any needs for any specific skills or certification that you might country might need? Because I think one of them from the Ministry of Health has taken the fire training recently. So I could please share the expectations from the ministry or the current situation.
Thank you. I think human resource aspect is one of the most complex aspects, like in any system. When it comes to the healthcare, I feel that there are like so many technical cadres. The priority at a national level, like from the Ministry of Finance, when they give funding for the positions, it is mostly to the health professional areas. So that like IT, health information, these positions take backstage to the health professional areas, because the human resource capacity or there's always scarce resources compared to the service that you are supposed to deliver at a national level. So yeah, at the central level, for Maldives, it might be the same for like many other countries. Central level, the capacity would be higher, like is higher, but then it's not even close to like what we want or what is needed even at the central level. When we move to like lower levels, the capacity is much lower. So like for group of health centers, there might not be a specific IT person. So the central level is supposed to like give the capacity or give the support to all those health centers. So what is really needed is dedicated IT capacity, but I also really like the competency framework from that Wipro is developing because we also need support, we technical support or guidance to evaluate or to assess the competencies that's needed at different levels in a country. Currently, we've got in the president's office, similar to the prime minister's office, we've got IT team uh, supposed to lead the IT framework in the whole country. But I feel like to this date, we don't have a national architecture. We also have a National Center for Information Technology, again, to help all the sectors or different ministries in the IT digital initiatives, and then to coordinate even at a government level on the digital initiatives. But over the years, I feel that our National Center for Information Technology has reduced their capacity because they've lost their technical people to the private sector. Uh, and very recently in the Ministry of Health, we used to have the same division for policy planning, international relations, and health information. So a change we brought is to bring focus to health information research, digital health. So a specific division for this area. So policy planning, international relation is now separate. But again, with the government's pay scale, what we find is you might have the positions, but when you advertise, nobody applies for the position. So it's still vacant. The pay scale overall in the government sector is lower than the private. So it's very difficult to attract the IT people. And whenever you attract, it's very difficult to retain them. So it's a whole cycle. And the capacity building programs at a national level is limited. So more collaboration support like from groups like AHIN, other country support is the way forward, because in small countries, I feel you can't develop everything, but you can work through collaboration. Thank you.
Thank you, Sami.
I think it's a very valid point because we need to have a south to south collaboration.
Yep.
So country to country, probably we need some certain specific areas like fire training from some other country. Probably we can share some of the things to the Maldives. Likewise, we are very happy from the Ministry of Health side to do that.
Thank you.
Right.
Thank you, Dr. Palita. I think more to Nepal. Do you have any specific need, or do you have already a dedicated team for digital health, or do you need such a team? And then if you were to need such a team, what could be probably the QR or the skill set that you would require? Thank you.
Thank you, Zef, for the questions. Actually, in my country, we have the three tiers of the governments. After the reform, federal systems, now we have the three types of governments. So we have the 7 provinces and the 753 LLGs. And all are the governments, all are the autonomous governments. If you look in the central level, in the ministry, basically the main function of the ministry is to develop the policy and strategies. But if you look the implementation part for the health sectors, we don't have any confusions because we have the Department of Health Services. So, but in the health under the Department of Health Services, there is no any IT separate divisions or separate section, even sections. So in my sections, there are the IT guys. I have the IT engineers, I have the IT officers under my sections. I look the two section, one unit. So I have. So then main confusion is there. So near future, we will just take decisions to IHMIs lead the IT. We are going in that way, and we have already talked to the secretary, and we have already talked to the our DG department, director generals about these issues. So near future we will settle that part. And one of the very good thing is in every local level, 753 palikas, there is the IT persons already authorized IT persons, government allocated theirs. And if you look the province levels, in each province, there are the 1 and 2 IT person there. These are functioning. And we have the very good IT strategy, IT policies, and then the IHMS roadmap we have. For the legal aspect, we don't have any problems. The main problem is for the just clarification of the role of the IT in Department of Health Services. One thing, and regarding the your questions regarding the capacity building, near futures we are going to take MOE to the Kathmandu University and the Minister of Health and Populations. So every year, Kathmandu University produced 400 IT engineers. That university had that much of the capacities. So in the EMOA, basically we put two special points. One is every 4 months they provide the 5 to 6 IT persons to my sections, to my units, and then they replace every 4 months by the another 4 persons. So we are taking in that way, and that is the OJT, on the job training, and it is the on the job training with the curriculums. So that is, so they work under my sections.
They are like interns.
They are like just like interns. That is the one part. And just on the behalf of my ministry, we request to the Kathmandu University, and from this year, Kathmandu University already started the master degree for the health informatics. They started, and Kathmandu University provide the 5% scholarship for the Minister of Health and Population who are working under the government systems. So we are going in that way, and near future we are build the interoperability lab for the Kathmandu University by taking support from the GIZ. We are thinking in that way, but still we have to perform. We have to do a lot of things to strengthening this digital health system in Nepal. Thank you.
Thank you, Dr. Anil. Just wanted to ask, like, I know that for the Digital Health Planning National Systems course, we had the highest number of applicants from Nepal.
Yeah.
And we really had to really think a lot to actually cut down the numbers because the overall cap is 100.
Yes.
So apart from this, like, do you see any specific course or a certification that your team might require?
So regarding the certification, especially for the certification, we are more focused on the fire training, especially which is used for the interoperability. And that is the one. And also for the infrastructure, standardization of infrastructure, that is much important. So that's really very necessary for, or even for the university or the guys which are available in the local market. Because if we can certify those peoples, then we can get this quality service in the digital health. So we need that one. Just want to add one thing that, let us take technology as a cross-cutting issue rather than one, educational pillar. It need to be integrated with all the subjects. It's not only as a technology as a, one subject. Let's integrate that technology inside the medicine faculty, inside the agriculture, or inside the social studies. So let's take, if we take this one as a cross-cutting issue, then this will be not problem. The real problem we are facing right now, the physician, the clinician, they are not using the computer. They are always, when we are deploying the EMR, they are very much happy to write down their prescription in the paper. So that training need to be given in there during their MBBS and MD training. So let's put the in the cross-cutting. That's one.
Thank you.
When our friend Francis present the situation in Philippines, I would like to ask the question.
Please ask.
Yuli, sorry, Yuli. When you're talking about the program management, and Philippines is the model of the governance for us, and then we look and you can form the program management office. I mean, maybe ahead from many countries, and you just talking about the activity and the the works that in the program e-health program management office. My question is that when you change the leadership, is this affects any kind of the program, the people and the program that the management of the program, and how would you recommend the other country to for that kind of the changing environment or changing the leadership?
Hello, Dr. Bunchay. Good afternoon. For the Philippines, since our program management office is already institutionalized within our office, that's the Knowledge Management and Information Technology Service, the ICT arm of our Department of Health. Whenever there's a change of leadership, what we just do is to present our existing structures and the proposed directions and how we will align them given the directions to be set by the upcoming administration. So for example, right now we have a new health sector strategy, and we have an ad interim secretary of health. So what we are doing is we align first our directions based on the directions provided by that strategic document, and at the same time we develop our activities, our plans based on that direction while maintaining the human resources or the program management office capacity to align with those requirements. So basically, there's no need to change your program management office, but you might need to tweak in terms of the capacity to align with the direction set by or being required by the new administration. So for us, it's easier to transition because the program management office team members are already institutionalized within our offices and with other government agencies. Thank you.
Okay, thank you.
Dr.
So
Yuri.
institutionalize the governance and the program management is it seems like one the good suggestion that the country should do. Jai just asked me to kind of the chair the people and program management in Thailand. Actually, it's a lot of things that I can share. I will do the longer version. Okay. 10 years ago, 10 years ago, we do the research on the current e-health status in Thailand, and we found that we have four things that we recommend the communities. One, that the IT pervasive in health sector is very pervasive, but what we don't have is that the foundation. The foundation is the standard and the architectures, and also the systematic way to strengthen or to create the informatic and health IT workforce. That the third bullet that we think that the country should do. This is 10 years ago. And then we identify that when we talking about people, it's like our friend said, that it's not just the people who do the IT, but the professional who use the IT and the one who develop the IT. So if you, to me, I think that is miss kind of the policy maker when they talk about the health IT, they're thinking about the IT people, and this cause a lot of problems because of when we talk about workforce, we have to talk the whole spectrum of both user, developer, and the IT who do the I mean routine, not the routine one, the management of the network of the something like that. But we forgot the other two, and the policy maker maybe said, oh, if you already have the health IT, so it not you don't need any manpower, something like that, and it caused a lot of problems. it have to be, we have to learn from Sri Lanka. I think the Sri Lanka is the leading, or that seeing that the professional and some doctor are or health professional can be very good on, I mean, linking about the IT people and the user and also the developer, and they create the area, the position of the health professional, not just the IT, to growth. You can see that Maldives, Thailand, and many countries, we struggling with this kind of the position. There is no career path of the people who are doing like the linkage between the IT and the health side, like our friend says. You know that is the missing piece, and I have to be I think praise Dr. Wajira vision and the work in Sri Lanka that can push this. I think to me, this kind of thing had been happened in the US 20 years ago, and the American Medical Informatics Association pushed very hard, and then they have the subspecialty. If you are the cardiologist or the family medicine or pediatric, you can have more credit by taking the subspecialty on the clinical informatics, and those is the career part. And right now, there is a lot of specialty doing this kind of the subspecialty similar to the Sri Lanka. So, but Sri Lanka are advanced compared to many countries because of they see not just the health IT people. For Thailand, we try to follow those model, but it is not us who are practitioner to push this. It's kind of the policy, and whenever you cannot change the finance, right? The Ministry of Finance to see that you have to have this position, then the health professional who do this kind of the work are have no kind of the career path, and it's very hard to find. But for Thailand, I work on the human workforce and strengthening in informatics for many years, and one part is that persuade the university to create a diploma curriculum on the informatics to complement the. There is many computer science, computer engineer who do the IT, but not much into do the informatics side. And it's starting to become aware by the health professional, but there is no career path. You can see the link between the policy of the career path and then the actual thing. Most of the people, health professional who do this in Thailand is by passionate. They want to do kind of they don't want to be the doctor, they don't want to be the clinician, but they want to make a difference in the health system, similar to pharmacists, nurse, and many more. Another push that we go through the Thai Medical Informatics Association, that go trying to propose to the Ministry of Health, we call the Ministry of Public Health in Thailand, to increase the position of the who work in the health IT in the hospital. But like Samir from Maldives said, they are give the priority to the professional, right? The practice, the care, but not the back end, the one who do the support. We still not success on that. So for the the bottom line is that we trying very hard to do all through all spectrum of the people who will do the health IT, and we are not very success, but it's becoming aware by the policy maker manager that we need those, and lucky that right now we can pursue the, maybe not we, because of the COVID, because of the advance of the digital health, uh, at least 2 or 3 university medical school, they create a new track for the medical student that they can take 6 years for the MD, and they can take another year to get the master degree in data science and informatics. And this is just coming in the next 2 or 3 years, and we hope that we are going to be able to educate from the bachelor degree from the medical doctor.
Thank you.
This is the longer version. Thank you.
Thank you. Thank you, Dr. Bunchai. I think you also stressed about the career pathway, which I mentioned initially, because I think this is sort of directly proportional to the retention ratio. You like to, Solon, you like to say, yeah, thank you. In fact, like we do have, like through AHIN, we had facilitated a collaboration between Mahidol University and the Foundation PFAP. And then they have been offering the fellowships in the region also. And 2 of the students from, is it Cambodia and Indonesia, Dr. Bunchai?
No, yes, currently
Okay.
in Maidal, yes.
Yeah, thank you.
Thank you. No, thank you. You know that the Foundation Pierre Fabre is mainly working in Africa, but I would like to share some insight from our perspective as we are supporting some initiative in training for health workers since several years now. But of course, it's that's a common mistake that we can see from the beginning is that the lack of consideration for the trainings for the IT tools for health workers. That's why we created and support the Professor Sheikh Omar Bakayoko in Western Africa for this inter-university diploma. But I think that this is one of the solutions, of course, but we should include the training since the beginning in the curricula. I mean, because for the next generation, every health workers should have to use the IT in the common workday. So what I would like to highlight is, of course, we are mainly working in Western Africa, but I think that we need to foster this type of intervention, even here in Asia, because I heard that it's a lot of need regarding the practicability for these tools. And the second thing is that for the program management, I observe that we often put only technical person in charge of management, but management is another type of skills. So we really need polyvalent and multidisciplinary people, and we need to train them too.
Thank you. Thank you. Very valuable. Dr. Moni, the same question goes to you. And then could you please share the perspectives from Cambodia?
Good afternoon. Thank you very much again for all ladies and gentlemen in this interesting workshop. The point that I see that this is concerning to program management, and most countries try to say something on the lack of human resource, lack of the IT, lack everything. During develop digital, this is not a kind of to support AHIN. AHIN know this situation already, and AHIN know that this country is a lack of resource, a lack of budget. So AHIN know already. But what is the AHIN want to see from different countries? This is the concerning to the program management. Some countries change their system from a fragmented system to the integration system. And then AHIN know already. AHIN see the difficulty, see the situation already. But what is the key message that from different countries want to support AHIN? So we don't see this here. We don't see the key message. We see the problem that the one country change their system to the digital, from the paper-based, from this, from that, and then they don't see, they don't support or provide key message. So what is the key message that we need to support AHIN concerning on the program management? So most countries should do this, and AHIN will collect every experience concerning to the program management key message that AHIN will develop when we we change, we develop to the digital health system, and then toward universal health coverage. What is the key message that most of the country should support, should provide to AHIN or share information concerning to this? This is my personal idea that I want to say. So I don't see this one so please support it. Otherwise, he will see a lot of difficulty from different country, and they at the end they say goodbye. I have no idea.
Thank you, Dr. Mani. I
So
think
thank you.
we invite you to join the Ehin Hours that happens every month, several weeks, in fact. So would like to have you and your team from the Ministry of Health joining us in the webinars that happens every month. I'm sure that Cha will be sending out the to you starting from next week. Thank you. We have very interesting webinars lined up in the year.
So this one is not as long as Dr. Bunchai's. But I think one of the realizations, after almost when we started the PMO in DOH was 2013, I think Yuli. So there are several hurdles. The first hurdle is creating the PMO, and we were fortunate then because the Secretary of Health, he realized the need to create the office. So it was easily created. It's not always the same in other ministries. You don't get the minister or the secretary to just quickly agree to create an office. So we were lucky that way. The next is when you now have the office, you now have to build the capacity of the office to, and then you have to. It's learned along the way. Like you conduct the meetings, you take notes of the meetings, you gather the different other ministries, make sure that they have representation, that there's documentation, and that you're tracking their commitments in the meetings, and then preparing them for the next meeting. That we have our meeting is next quarter, and in that meeting we will ask you about the status of your respective projects, because digital health projects are not all inside the Ministry of Health. Some of them are infrastructure by the Ministry of ICT. Some of them are electronic claims by the insurance agency. So the coordination is the work of the PMO, communicating with the different ministries and asking them what's the status, because we're going to present back to the ministers and the presidents of the insurance agencies what's the state of the art or what's the state of their projects. That's a big hurdle in itself. So I think a lot of the PMOs will be challenged just with that burden of having to coordinate with the other ministries. Once you do that, then the other stakeholders, the broader stakeholder environment gets sensitized that there's a digital health PMO and there are digital health activities in the country, and so they start asking, what's happening? Can you tell us what's coming around the corner? And so now this is the third hurdle, which is communications, and it's very difficult because you're one PMO. I don't know, Yuli, how many you are in the PMO right now, but there's 110 million Filipinos who might be starting to call, sending email, asking questions, clarification. What do you mean by this? What do you mean by that standard? And I think that's one of the challenges that all PMOs will face is how do you now face the increasing demand for digital health information? And that's why we created the Philippine Society for Digital Health, because it's very difficult for a PMO to do all of these communications as well. So I think Dr. CP Wong for Digital Health Malaysia and for the PSDH, we'd like to offer that service to government so that once they come out with a policy, then the PSDH by themselves, a community, can try to explain to each other what the policy is all about and become like a advocacy group within the country to help each other understand. If we don't do that, the PMO is going to be swamped because the burden of explaining all of these policies will be left on their shoulders alone. And I don't think any PMO in the world will be able to address all of the questions that will come out from the different stakeholders, private and public sector. Thank you.
Thank you, Alvin. I think that also connects to something that happened in India. In fact, in March 2020, when the government of India released the telemedicine practice guidelines, there was a huge mandate, like we need to train millions of doctors on this do's and don'ts of this practice guidelines. And then because government wanted the doctors to practice telemedicine because there was a national lockdown and there was a problem of people reaching the health facilities. And then they didn't also want people who need not actually come to the hospitals to come to the hospitals and overload when there were COVID cases. So actually two of the associations, Telemedicine Society of India and then Digital Health India Association came together, came up with a curriculum based on the telemedicine practice guidelines. Within 14 days, it was delivered online free. And then for anyone to sign up, and then there were, these were practical lessons, like how to set up a telemedicine practice, what are the do's and don'ts, because the policy says some things, but then that needs to be translated into something that can be understood by the clinicians. So this was actually a very good case. I could relate to what Alvin mentioned. Also, the National Digital Health Blueprint, and then any such policy documents that come out, like typically these associations actually come together with the members and give their critical views. So this is like rather than an individual, like the whole organization actually gives. These are the two things that I would like to share from India, and then I could see Charity ready to share something. Thank you.
Just to add to what Yuli and Doc Eloy said, you know what? It also helped that the the Department of Budget and Management was very supportive of our e-health. Then there was this
That's very important.
initiative called MITI, which is the medium term information. What? Yeah, medium term IT harmonization initiative, and that was and also that in that MITI thing came with a lot of funding.
Thank you. Thank you. I think 20 minutes ago I was told there were 20 minutes left. So now I think we should also cover, I think sufficiently the ministries of health representatives have been covered. So probably I think more to the development partners I could see here, Merrick and Sean. Merrick from USAID and Sean from UNICEF DICE. Like you actually support a lot of countries, and then you do manage digital health programs. Do you have digital health strategies? And then do you take the support request, TA requests from the countries? So what do you think are your views on this? Like the questions are, if you want me to repeat the questions, I will repeat, but then like what are your views on this? And then you've also been supporting, for example, like USAID has been supportive of AHIN to deliver the digital health planning national systems course. And then you may be doing it for your own country offices also. So what do you think that what is the way forward on this? Like have you come across situation where you countries do have specific program management team for digital health? And then do you have asked from them for any specific skill sets that need to be trained? Over to you, Merrick and Sean. Thank you.
Thanks, Jai. And I actually want to talk a little bit, maybe expand on some comments that Boon Chai had raised. And again, great to see this more systematic approach. Trainings are expensive; they take a lot of time. People leave. There's brain drain. I think one of the things that I've seen, and I'm hearing that many countries in this room have done this, but looking at, for example, with software and digital public goods. What is your country's strategy in terms of procurement or development, support and maintenance? Because you need very different structures. You need very different cadres of Ministry of Health, ICT workers, and very different skill sets. So when we talk about TOGAF training and COBIT-5 training and all those other skills that are needed, quite often I don't see countries starting with, well, we want to apply a SaaS model, and what we really need is a systems architect and a few business analysts, or we want to develop and maintain, the digital public ourselves. And so matching that up and really understanding what the costs are, because those different models, when we look at software, we often look at the procurement costs or the maintenance costs, but when governments actually want to take on more of that software development and software support roles, that has a human resource cost as well beyond training, and being able to weigh the different options because each have their own cost and opportunities and benefits, and really looking at this through from the beginning, even before we start to really go in hard on capacity building. We need to know what capacities we need. And this is something I know we're talking to Merrick and others about in terms of competency frameworks and looking at, how many people need a TOGAF certification? Not everybody within a Ministry of Health ICT team. So being far more deliberate and strategic with matching the trainings with the approach that each Ministry of Health is going to be taking in terms of their software application, procurement, development, support, and maintenance. And so I think the one suggestion I would have here today is don't put the cart before the horse with this. Figure out what really you need first. Make sure that that's captured in the strategy, and then make sure that people are accredited, are trained, have the capacity to deliver on that function.
Sean, before you go,
Yes.
Is there any menu that you would like to offer? You suggest, like for example, AHIN comes to you and then say these are the capacity needs that countries have asked. Like, if can we come to you, or if we come to you, what kind of capacities that probably UNICEF could support? The same question will come to you.
Yeah. And this was actually in a presentation earlier by Mark Landry. And so I think it's actually one of the better frameworks that I've seen in terms of, the digital health planning national systems course. Really valuable for everybody. And I don't remember, somebody made a comment about ensuring that non-technical staff are also trained. That kind of basic level of digital literacy, digital dexterity is required. But as you start to get more and more technical, different skill sets are needed by different parts of the team. And I would look at that framework that Mark had posted either yesterday or this morning as one of the kind of better models that I've seen out there. And a lot of the accreditation, the courses are not that expensive. The fire course is, I think, $39 for accreditation. I was looking at TOGAF, that's like $400, $500. COVID, I think, is a bit more, around 1,000. But these would absolutely be areas that, as UNICEF, as other donors, it's likely that many of our country partners would be willing to support. I think it's a great investment as well, because these accreditations make people in the ministry more valuable. They, their ability in terms of their career path is significantly enhanced because these accreditations, these widely recognized accreditations, are what many companies, businesses, organizations look for. I think one of the things I was chatting with Merrick about is the value in going with already recognized accreditation services, rather than trying to build courses that really won't be mutually recognized by others. And so, I personally would, and this is some guidance that I'd been giving to some of our countries in the Middle East a couple weeks ago around, if the Ministry of Health needs support around enterprise architecture or ICT governance, let's support accreditation with those recommended training programs. And again, I look to what Global Fund put up in terms of these are some pretty solid courses.
Thank you, Sean. Merrick.
Yeah, so just to echo what Sean said there at the end, yes, this is definitely something that USAID is looking to help support. And so I think that the more structure there is around, here are the competencies that we, recommend ministries have, here's what they currently have, here's what they're missing, the easier it is to, I think, do that. But I think to a larger extent, if those competencies don't exist within a ministry structure, then the World Bank hires consultants, or USAID hires consultants, or Global Fund hires consultants, and the expertise is paid for and developed outside, and the plan is developed and paid for outside the immediate purview of the ministry, which then creates, if everyone has independent plans, creates the foundation for fragmentation. And so I think it's critically important that those skills are developed, maintained, and supported within the ministry structures themselves, so that the plan, the vision, and the ability to execute it is within the country's purview. Which is, we're going back to what I was talking about at the opening remarks this morning, is so much of what USAID is trying to now shift to its support to focusing on. And so that if the countries capacitate the staff, generate the plans, it's much easier for donors and partners to step up and say, we're going to support the plan that's being put forward. So I think that's really, like, at the end of the day, absolutely critical, and we're happy to help work with you to understand how to support I think a standardized approach to competencies within the region.
Thank you, Merrick. I think one of the areas that we could work together with both DICE and USAID, with both of you, is I think the community around the digital health planning national systems trainees. I think, as I said, like I think after the training, if they are not engaged in a meaningful way, I think the benefits of the training dissipates away. I think it's best to have probably the community built around this. I think probably DICE cohort and then AHIN cohort. I think between us, we will at least have 300 of the trainees in the region. So I think it will be very good to involve. And then I think we've come to a close of this workshop. And thank you very much, Dr. Chansali, Anis, Dr. Rudy, Dr. Moni, Alvin, Dr. Bunchai, Sami, Fazila, Dolan, and then Dr. Fadli, and then Raj, Dr. Palita, Dr. Bunchai again, and then and then Dr. Hasita and Dr. Anil Tapa, and then I hope I didn't miss anyone else. Did I miss anyone else? I mentioned him. I mentioned him. Thank you. I also thank Serenen for being here and sharing the views. Thank you.
Actually, I would like to respond to our deputy director from Cambodia about that. He know everything, and what is the point? You know, he not know we are the community, and this is why we come here and share the pain, you know, and also the solution. And I think it's right that Jai already asked the developing partner, our foundation and developing partner, how we gonna work together to build the capacity in Asia. That's what I would like to point to. What is the point that we don't know anything. We just come and share the pain and also the solution that we have.
Thank you, Dr. Bunchai. I think over to Dr. Poshia.
Every year, we're actually going through different styles of workshops. And for those of you who've attended the earlier one, audience, and we had small group discussions and all of that. So nevertheless, what we had today is, I hope, sufficient for now. The first time we got together again and hear the rich exchange of experiences also since we got together, and I hope it was also beneficial for the country representatives. To end this day, for a wrap up, let me call on Dr. Anis Fuad to synthesize and also give an overview for tomorrow's session.
Thank you, Dr. Portia. Our friends, we have passed the first day of our IHIN General Meeting. We start with, I think, important quote from Dr. Bunchai. We are facing the same storm, but we are living in the different boat. And our workshop shows these different boats in every countries, and we learn a lot. And hopefully, but I do not know whether there is also another opportunities. One Minister of Health in Thailand after retired and then become in another Ministry of Health in other countries. Because they learn a lot about the successful digital health implementation in Thailand and then become the advisor in other country. So not only about sharing lesson learned between all the team who are currently struggling to face the storm, but also learning about how to handle when the storm already ended. And then we learn this lesson to other countries. I think that will be important lesson between us. And after the session of Dr. Bunchai, we learn also many important messages from our development partners. And I think from the messages, among the important issues is that they show support and also expectation from their part to our communities. And hopefully we could use this opportunity to improve, to strengthen these communities. And I think before that, Dr. Fazila already explain the landscape of digital health in among the countries, and then we going into detail in this workshop, especially about the governance and people and program management. And hopefully this session meet your expectation after 2 years living separately, meeting virtually, and then the first day could fulfill your expectation who come from many other part of the world, including from France, and you finally meet these many faces in Asia. And for tomorrow, we will start again at 9 a.m. sharp, and then we will follow the next step of the workshop. Will be led by Dr. Bunchai and Dr. Fazila. We will explore more detail about the enterprise architecture and also standard and interoperability. And I just remember that Dr. Bunchai mentioned both, but when I first learned IHIN, when mentioned enterprise, I just remember a movie when I was child, a Star Trek Enterprise ship. So I do not know whether tomorrow we will discuss about from the boat and then becoming an enterprise, USS Enterprise. Hopefully we'll bring the digital health to another centuries. And we will end, we will continue with the IHIN business meeting and then with the closing ceremony. I think that's all. The wrap up, and enjoy your time. And
So thank you. A round of applause for everybody's. You all worked hard this afternoon.